Hello, my name is Joseph Florio, and for my signature assignment for microbiology, I chose the pathogen of influenza. Now, this is most commonly referred to the flu, and it's basically a common virus in the United States and as well as the rest of the world. And the textbooks actually states that influenza is important for the study for three different reasons. The first reason being that the flu is a common disease. It's popular during the winter months in the United States. The second is that it's a wide variety of symptoms and has similar effects to the flu, and it's only correctly categorized if the disease is caused by the influenza virus. So yeah, so the flu and the influenza virus go hand in hand together. It's not considered the flu unless it has that influenza virus inside of it. And the last important reason that we actually do it is because the textbooks list for the reason of pathogen study is that it's actually constantly evolving. So it's one of the main known viruses that is always constantly evolving to change it to different various forms of strains. Also known as a seasonal flu, the virus can change and take in many different forms to cause different symptoms that can cause a wide variety of demographics and even cause different regulations for vaccinations. According to the CDC as well, the flu is categorized by respiratory illness and is only considered a flu if it is caused by the influenza virus, like I said before. The life cycle of itself can be separated into different stages in which there's the entry to the host of the cell, entry of vRNPs to the nucleus, transcript/replication to the viral genome, export of vRNPs from the nucleus, and assembly/budding at the host cell plasma membrane. During the entry into the host cell stage, once receptor-mediated endocytosis occurs, the virus will then infiltrate the host cell in an endosome, binding itself with the endosomal membrane. This bring this brings both the viral and endosomal membrane in contact with each other, as well as making it more suitable for environments for the influenza virus. During the entry of the vRNPs into the nucleus stage, we see that the proteins that make up vRNPs, which are used for nuclear localization and are required for nucleus entry so that the virus can be released into the cytoplasm. We also undergo the transcription/replication stage while we're in the nucleus. When this is completed, we also see that vRNPs leave the nucleus to then export a vRNPS stages. This lastly gets us into the last stage, where after leaving the nucleus, the virus will undergo its final stage, in which it will go infect the other neighboring cells around it. This influenza virus infects respiratory epithelial cells that line the upper and lower respiratory tract, primarily NIHT. Now, influenza comes in different forms, but it mainly comes in the respiratory form of tiny droplets that can affect with the transmission of a cough, sneeze, or talking. If these droplets also land to any four-mite areas, it can also be spread through that way as well. Because influenza can live outside the body for approximately 48 hours, the disease can also transmit itself by touch or in an infected surface area. And even more highly unlikely than that, it could also be infected if the droplets enter through the eye as well. While it's also considered rare, while also considered even more rare than that, some forms of the influenza can actually be transmitted from humans or from animals to humans and vice versa. But more commonly, the versions of influenza we know as are transmitted from human to human. Now, the most popular form of prevention against influenza is actually the vaccines. Especially with the many forms that the disease might take, vaccinations are super crucial to keeping up with the body once it's been infiltrated. Other forms of the prevention can be wearing gloves in highly contaminated surface areas and wearing masks as well. Now, influenza could cause a wide different variety of symptoms. Anatomically, the disease itself begins outside the upper respiratory tract of the body, but can easily affect the lower respiratory tract as well. And in more serious cases, for physical symptoms of influenza, it includes headaches, chills, dry cough, fever, and much more serious cases like stuffy nose, sore throat, and if it is left untreated for a long period of time, can lead to pneumonia, which is also fatal as well. Now we see that the trend of mortality actually decreases over time, displaying the improvement of prevention/treatment since the beginning of it being discovered. Now, there are different ways for it to be diagnosed, where an RT-PCR is the most preferred method for diagnosis of influenza. Symptoms are generally the best rule of thumb for the indicator for this once it has infiltrated the body. There are a couple different ways in which influenza can be treated. There are Zenbuvir, which is like Relenza, is a medical drug that is taken by inhalation, and Tamiflu, which can be taken by ingestion to treat influenza A and B. The side effects are a little bit different between both, with people having a low percentage of a runny nose, dizzy, nausea, vomiting, and headaches. And there is a great amount of treatment options for influenza as well, though. The most ideal solution being prevention against the disease, which could be through vaccinations. The most common form of the influenza is the vaccine through either injection or through a nasal spray. These vaccines will insert a death virus or an unattenuated one. This will basically trick the body into thinking that it's being infiltrated by the disease itself and develop the antibodies to combat that. Now there is a wide variety of different influenza and different flu viruses. So the CDC will basically put out the most popular 3 to 4 strains every year and put it in a vaccine based on the prediction. And that will be the vaccine that they do for the year. So that's why it's actually really recommended to get the vaccine yearly, as there are different ones that come out throughout the year. Now, the demographics for this is highly susceptible to everybody. However, it can severely change in different trends amongst the age group. According to the graph, we see that there are several reactions to pediatrics used from 0 to 4 years and can increase again when it gets to the elderly age, which is 65 years to older. Amongst the rest of the world, though, the United States is one of the countries with the least amount of respiratory deaths compared to the rest of the world, as depicted. Studies actually tested out this for artificial intelligence as well, being able to diagnose influenza. Basically, how they did this, they got a study of 4,765 patients aging from 6 years old all the way to 90, diagnosed with influenza-like symptoms. And a pharyngeal camera was developed to take images of participants. These images were then put into an AI model to predict the probability of the RT-PCR confirmed influenza using the images and clinical information. The study actually proved itself successful, performing better than 3 physicians and actually predicting the influenza in the case study of patients. Thank you.